Thanks, Presiding Officer. Today's statement coincides with the publication of the revised strategic framework for tackling COVID, so I will set out the key elements of the new framework and explain what it means for our collective response to COVID now and in the months ahead. At the heart of the framework is a desire for and increasing confidence in our ability to achieve a sustainable return to a normal way of life, even as we remain prepared for future threats that COVID may present. So I will start today by describing our updated strategic intent and approach. This new approach will see us resort much less, hopefully not at all, to legally imposed protective measures. Instead, we will rely predominantly on vaccines, treatments and sensible public health behaviours and adaptations. However, much as we might wish it was not the case, COVID is still a public health risk here and globally, and likely to remain so for the foreseeable future. So we must also remain vigilant and prepared. To that end, I will also outline how we will categorise and respond to future risks, including from new variants. And I will explain why our decisions must be based on a combination of data, evidence and judgment. Thirdly, I will give our assessment of the current situation in Scotland in light of recent data and set out an indicative timescale for lifting or converting to guidance the small number of legally binding measures that still remain in place. And finally, I will set out our commitment to continued access to PCR and lateral flow testing free of charge, while we transition to a system of testing that is more targeted, but which retains adequate capacity to support surveillance, rapid response to the emergence of new variants, effective outbreak management and access to the best care and treatment for those who need it. And I'll also confirm our advice that those testing positive for COVID should continue to self-isolate for now. On the issue of testing, Presiding Officer, I must express frustration at the UK Government's position. It is, of course, for the Prime Minister to decide how best to tackle COVID in England. However, current funding arrangements mean that while taxpayers in all 4 UK nations contribute to the costs, it is decisions taken for England that determine the resources available to Scotland, Wales and Northern Ireland for testing and other COVID measures. As of now, we have no clarity on how much of the COVID testing infrastructure the UK Government intends to retain, no clarity on how much investment will support it in future, and no clarity on whether the Treasury will provide additional resources or demand instead that funding is taken from elsewhere in the health budget. I hope we do get this clarity soon so that we can then set out in more detail our own longer-term approach to testing. However, and I'll say more on this later, I want to give an assurance now that the Scottish Government is determined to retain a robust testing system capable of providing Scotland with strong resilience against future COVID threats and firmly aligned with public health advice and the principles underpinning our National Health Service. Let me turn now to the key points in detail, starting with our revised strategic approach. In earlier phases of the pandemic, it was important to try to eliminate COVID or suppress it to the lowest possible level, because then we did not have vaccines or treatments to protect against the serious illness and death that the virus can cause. That is why our objective initially was to suppress the virus to the lowest possible level, though we modified that somewhat last year. In today's update, it is modified further and now expressed as follows: to manage COVID effectively, primarily through adaptations and health measures that strengthen our resilience and recovery as we rebuild for a better future. This change is possible because widespread vaccination coverage and better treatments have reduced the direct harms of the virus. As a result, using restrictions to suppress infection is no longer as necessary as it once was, and given the wider harms caused by protective measures, it is no longer as justifiable either. The strategic framework, therefore, makes clear that in future we will seek to rely much less on legally imposed measures and more on vaccines, treatments and sensible adaptations and good public health behaviours. As a priority, we will continue to ensure the maximum possible availability and uptake of vaccination in line with expert advice. While the success of the vaccination programme has exceeded our expectations, there are today still more than 600,000 people over 18 who have had a second dose but not yet a third or booster dose. So there is more still to do to maximise uptake. We will also continue to extend the scope of vaccination. Last week, the JCVI recommended that all 5 to 11-year-olds, not just those at highest clinical risk, should be eligible for the vaccine. And I can confirm today that vaccine appointments for this age group will issue from mid-March. To allow parents and carers to attend with children, most appointments will be in the evenings, at weekends or during the Easter school holidays. Yesterday, we also accepted JCVI advice on protecting those at highest risk. It is now our intention to offer care home residents, those over 75 and anyone over 12 who is immunosuppressed, an additional booster 6 months after their last JAG. This phase of the programme will also start in March, though the scheduling of appointments for individuals will depend on the timing of their initial booster or third dose. In addition to vaccination, we will also use the best available treatments for those who need them. There are already effective treatments available which reduce serious illness and death in those who have been admitted to hospital with COVID. Therapeutic medicines are also now being offered to patients who have not been hospitalised but who are assessed as being at greatest risk of needing hospital treatment. And new oral antiviral treatments are currently being evaluated through a UK-wide study. We will make the best use of those treatments depending on what the evidence and expert advice tells us about their efficacy. Vaccination and treatment will play a major, perhaps the major role in limiting the health harm caused by this virus in the months and indeed the years to come. However, it is also important to encourage and support people to adopt safe practices and to make basic adaptations that will help keep us safe. The document we are publishing today gives more detail on the kinds of behaviours and adaptations that will be encouraged in different circumstances. These include enhanced hygiene across the general population and improved ventilation in workplaces and other settings, and especially when levels of infection may be higher, increased hybrid and flexible working and the use of face coverings in some indoor public places. It is less likely that any of these measures will be legally imposed in future, but we will advise them for as long as they help keep the virus under control and also help protect those who are most vulnerable to it. It is also vital, of course, that we remain vigilant for new developments. It is, unfortunately, highly likely that this virus will continue to mutate and confront us with new and potentially more harmful variants in future. To identify and respond to such threats quickly, we will maintain a strong surveillance capability. We will set this out in more detail next month, but subject to the point I made earlier about the overall resources available to us, our surveillance system will include extensive PCR sampling and processing capacity, wastewater sampling and genomic sequencing capability. We also welcome confirmation that the UK-wide COVID infection survey conducted by the Office for National Statistics will continue. It is essential, however, that it continues at scale, and we will seek to work with the UK Government to ensure that this is the case. Presiding Officer, this surveillance capacity will help us identify new threats rapidly. It will also help us assess the potential severity of any new threat and quickly determine the appropriate level of response. The strategic update we are publishing today sets out a clear framework for any decisions we may have to take in future in response to new developments. I want to stress this is intended as a contingency. We do hope, of course, that we never have to use it. However, it does recognise the ongoing challenge that COVID presents and sets out 3 broad levels of future potential threat: low, medium and high. It also offers illustrative examples of the type of protective measures that could be deployed in response to different threat levels, and it may be helpful to illustrate this through some general examples. If a new variant emerged that was more transmissible and more severe, perhaps with the ability to evade vaccine or natural immunity, this threat would likely be classified as high. In those circumstances, we might advise people to limit social contacts for a period and to work from home where possible, and we may introduce some temporary protections for high-risk settings. If a new variant, though, was either more transmissible or more severe, but not both, as is the case with Omicron, the initial threat assessment would likely be medium. In these circumstances, there may be a legal requirement to wear face coverings in some settings, and we might issue guidance for businesses and service providers on reasonable measures to reduce the spread of COVID on their premises. Lastly, in the absence of a new variant, or if a new variant was neither more transmissible nor more severe, and if vaccines continue to be effective, the threat classification would likely remain low. Obviously, this is the level we hope to reach and stay at on a sustainable basis. In these circumstances, there would be no legally imposed protective measures. Instead, we would continue to advise individuals and organisations to adopt sensible public health behaviours. It is important to stress that any decision about the threat level and what the appropriate response should be will be guided by data and evidence, but it is not an exact science. It will also, by necessity, involve judgment. That is because the kind of developments we may face in future, principally new variants, will not be uniform in their potential impact. A new variant that is highly transmissible but less severe would obviously require a different response to one that was less transmissible but more severe. So we must guard against a one-size-fits-all approach. That's why the framework doesn't propose fixed thresholds for action, for example, by stating that we will take certain predetermined steps if the number of cases rises above a specific level. Such thresholds may be superficially attractive because of the certainty they appear to provide, but they pose a very significant risk of both under- and overreaction. Now, the framework I have just described can be used to categorise our current threat level and therefore help guide decisions in the coming period, and I'll return to that shortly. But first, let me summarise the latest data and trends. Today, we are reporting 6,427 new cases from lateral flow and PCR tests. 1,060 people are in hospital, 9 more than yesterday. 25 people are in intensive care, the same as yesterday. And sadly, in the past 24 hours, 18 further deaths have been registered of people with COVID under the daily definition. And again, my condolences go to everyone mourning a loved one. Over the past week, reported cases have fallen very slightly by around 1%. They've fallen in all age groups under 45 and risen in all age groups over 45. The latest available data shows that hospital admissions have slightly increased again from 619 in the week to 11th February to 654 in the most recent week. And total hospital occupancy has also increased again, and we will obviously continue to keep a close watch on this. The number of people in intensive care with COVID-25 continues to be relatively low. So in summary, we continue to face a very highly transmissible variant that is causing a high level of community infection. However, while it is far from harmless, its overall impact is less severe than Delta. So using the framework I described earlier, we assess the current threat level to be medium. However, assuming the level of infection and its associated impacts, for example, hospital admissions, falls or broadly stabilises, we would expect this to be reassessed as low in the period ahead. This has enabled Cabinet to agree this morning an indicative timescale for lifting or converting to guidance the small number of legally imposed protective measures that remain in place at this stage. So I can confirm, firstly, that the COVID certification scheme requiring certain venues and events to check the vaccine or test status of attendees will come to an end next Monday, the 28th of February. The app which supports the scheme will remain operational, however, so any business that wishes to continue COVID certification on a voluntary basis to reassure customers will be able to do so. Second, as of 21st March, assuming no significant adverse developments in the course of the virus, we expect that the legal requirement to wear face coverings in certain indoor settings and on public transport will be converted to guidance. We will continue to strongly recommend the wearing of face coverings in shops and other indoor public places and on public transport. We also expect on 21st March to lift the legal requirement for businesses, places of worship and service providers to have regard to guidance on COVID and to take practicable measures set out in the guidance. And the legal requirement on businesses and service providers to retain customer contact details is also expected to end on 21st March. Presiding officers, governments obviously must act lawfully, and that means we cannot impose legal restrictions when it is disproportionate to do so. As the situation improves and the severity of the impact from COVID reduces, we are therefore duty-bound to remove legally imposed restrictions. But this should not be taken as a signal that COVID no longer presents any risk to health, because it clearly does. So even though certain measures, for example face coverings, may not be legal requirements in future, we will still recommend voluntary compliance as part of the range of behaviours that will help keep us safe as we manage COVID in a more sustainable and less restrictive way. Presiding Officer, let me turn now finally to testing. Testing has been, and it will continue to be, a vital part of our management of COVID. However, as the nature of the threat and our approach to managing it evolves, so too will our approach to testing. It is reasonable over time and barring adverse developments to move away from mass population-wide asymptomatic testing towards a more targeted system focused on specific priorities. These priorities will include surveillance, rapid detection of and response to new variants, effective outbreak management, particularly in high-risk settings like care homes and hospitals, and ensuring access to care and treatment for those who need it. However, it is vital that we make this transition in a careful and a phased manner. So in March, by which time I hope we will have more clarity from the UK Government on available resources, we will publish a detailed transition plan for Test and Protect, setting out our priorities in more detail and describing the scale of infrastructure that will remain in place for the longer term. The plan will also confirm the duration beyond the end of March of any transition period during which the system will operate broadly on the same basis as now. The public health reasons for ensuring a careful phased transition from the current arrangements to a more targeted testing system are obviously the most important. But we should also remember that hundreds of people in Test and Protect, at testing sites across the country and in our processing labs, including Glasgow Lighthouse, have worked tirelessly to keep us safe over these past 2 years. And these decisions affect their jobs and livelihoods, a point seemingly overlooked by the UK Government yesterday. So let me record our thanks to them today and give an assurance that the Scottish Government will engage closely with them in the weeks ahead. Presiding Officer, as we do this work in the coming weeks and for the transition period, subject to one change I will set out shortly, access to testing will continue on broadly the same basis as now. We will be considering separately advice for schools and health and care workers in line with expert advice. But for the general public, let me set out clearly what this means from now until further notice. Firstly, if you have COVID symptoms, you should continue to go for a PCR test. Access to these tests will remain free of charge at testing sites across the country. Second, you should continue to make regular use of lateral flow tests, even if you don't have symptoms. The only immediate change we are making to current arrangements on lateral flow tests for the general population is in our advice on the frequency of testing. Instead of advice to test before going anywhere to mix with others, we will from Monday next week revert to advice to test at least twice a week, and in particular if you're going to a crowded place or mixing with someone who is clinically vulnerable. Lateral flow tests will remain free of charge in the transition phase. Indeed, we consider it important, in line with the principle of healthcare free at the point of use, that they should remain free of charge for any circumstance in which government recommends testing, and this is a principle we will seek to uphold in our longer-term plan for testing. Presiding Officer, I also want to emphasise that in Scotland for now, we will continue to ask those who test positive for COVID to isolate for the recommended period, and we will continue to make self-isolation support payments available to those who are eligible. We will, of course, keep the recommended period of isolation under review, but I think it is worth stressing that isolating, staying at home when positive with a highly infectious virus and the follow-up tracing that Test and Protect does remains one of the most fundamental public health protections that we have available to us. It helps limit transmission overall, and in helping keep workplaces and other settings safer, it also provides protection for those most at risk of serious illness from COVID, enabling them to return to more normal lives as well. Presiding Officer, COVID is unfortunately still with us, and we must therefore remain vigilant and prepared for the threats it poses. But today's new framework is an important moment in our recovery. It marks the point at which we move away, hopefully sustainably, from legal restrictions and rely instead on sensible behaviours, adaptations and mitigations. A return to normality must, though, go hand in hand with a continuing determination to look after each other. All of us have a part to play in ensuring a safe and a sustainable recovery. So I'll close again by urging everyone to follow advice on getting vaccinated, testing as regularly as appropriate, wearing face coverings when required or recommended, keeping rooms ventilated and following hygiene advice. All of this still matters, even as we lift the remaining legal requirements. It is how we keep ourselves and each other safe as we recover from COVID and look forward now together to much brighter days ahead.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 40 minutes for questions, after which we'll move on to the next item of business, and I'd be grateful if members who wish to ask a question were to press their request to speak buttons now, and I call on Douglas Ross.
Thank you very much, Presiding Officer. Can I begin by saying that as we debate this afternoon, the grave situation in Ukraine is at the forefront of all of our minds. The Prime Minister has made a statement to the House of Commons that has rightly received cross-party condemnation for the actions of President Putin and Russia. For weeks, we have seen a build-up of activity and threats, but last night's statement from President Putin provided in the starkest possible terms the reality of what Russia is seeking to do. We must stand together, supporting the UK government, governments around Europe and across the world as they seek to deal with the current and future threats from Russia. But above all else, we have to make it very clear that we stand with the people of Ukraine. Turning to today's statement, we welcome the move away from blanket legal restrictions towards an approach based on public health guidance. 2 weeks ago, the Scottish Conservatives published our own blueprint for living with COVID, titled Back to Normality. Our approach focused on personal responsibility, trusting the Scottish public to make their own adjustments to protect themselves and their families. When our plan was published, the Health Secretary claimed it was reckless. Today, large parts of it have been adopted by the Scottish Government. They're moving face masks from law to guidance. They've finally scrapped vaccine passports and they're getting rid of mass testing. Reckless 2 weeks ago, government policy today. So can I ask the First Minister? Her statement says that the government is moving to a system of representative sampling away from mass testing. So why has the First Minister created a fight with the UK government over this issue just weeks before her own plans to scale back testing anyway? Secondly, the First Minister just said in her statement, and I quote, "Using restrictions to suppress infection is no longer as necessary as it once was, and given the wider harms caused by protective measures, it is no longer justifiable either." So can the First Minister explain why her government intends to extend the COVID powers it has at its disposal for a further 6 months until September, if it's no longer necessary or justifiable to keep restrictions in place? Why is it necessary or justifiable for the government to cling on to control over those powers and keep the threat of restrictions hanging over the public? And finally, throughout this pandemic, Scottish businesses have been left in the dark. They've been an afterthought for this government. The document published today is a plan for living with COVID. So can the First Minister tell us, did she personally have discussions and consultations with Scottish businesses before publishing that guidance and document, and can she tell us what their feedback was?
First Minister.
Firstly, Presiding Officer, on the dreadful developments in Ukraine, the actions of Putin are utterly indefensible and he must face the most severe sanctions as a consequence of those actions. The announcement by the Prime Minister just a short time ago do not, in my view, go nearly far enough. He described the limited sanctions announced today as a first tranche. I think it is essential that we see further tranches very soon with very severe sanctions imposed upon Putin and on interests in Russia. And we must all, and I hope across this Parliament, we will be united in standing in solidarity with Ukraine and with the people of Ukraine as they defend their independence, their sovereignty and their territorial integrity. And I'm sure that is something that will unite us across this Parliament and indeed across the country. Turning to the issues in my statement, Douglas Ross says that we have now done what he has asked us to do all along. Sort of pause to say that Douglas Ross, of course, opposed face coverings ever being a legal requirement. He opposed COVID certification ever being a legal requirement. He has, I think, opposed almost everything this government has done to try to control this virus and keep people safe from it. So the government will continue to take a responsible approach to steering the country through this virus. We will take decisions in a timely manner. We will be driven by the data, by the evidence and by the application of judgment, and we will not follow an opportunistically, thoroughly oppositionalist approach that is recommended and has been recommended at every interval by the Scottish Conservatives. On the issues that were raised in detail, firstly on testing, I think it's a bit rich, I have to say, for Douglas Ross to accuse me of picking a fight with Boris Johnson, but we'll leave that to one side for the moment. I think we all agree, and I have had many discussions with UK government representatives over the past days on this issue. We all agree that in time, or I think in time, we should move to a more targeted system of testing. The difference between the Scottish Government and the UK Government is we think we should do that in a careful, phased basis, and that we should give great care and thought into the testing infrastructure built up over the past 2 years that we retain for the future. To dismantle that in any significant way, I think would be inexcusable negligence given the threats that COVID still presents to us. Instead, we had an announcement from the UK Government yesterday of what they are stopping doing, but no clarity on what they intend to retain or the funding that will be in place to support that. And I think that is deeply regrettable, and we will continue to work with them to try to get that clarity so that we can set out our longer-term plans. But we think we should retain testing on the current basis for a transition period, and then in a managed and careful way move to a more targeted system, but one that nevertheless retains the capacity and the contingency that we may need in future. In terms of issues around continuing to have contingency measures that we may use in future, COVID has not gone away. It isn't the case that it simply disappears because we want it to. We may face, and the Chief Medical Officer for England, I heard making this point yesterday, it's highly likely that we will face new threats from this virus in the form of new and potentially more harmful variants. So we need contingency measures in place. We need to make sure we have laws that are fit for purpose, and that's what this Parliament is currently scrutinising in terms of the coronavirus legislation, and we will continue to do that. And on the, lastly, Presiding Officer, on the issue of business, my ministers engage with businesses on the detail of this, as is right and proper, and we will continue to do so, and we will continue to take appropriate steps to keep businesses safe while we keep the overall country safe. And I'm sure there will be many people across this country who will just breathe a sigh of relief that Douglas Ross hasn't been in charge of these decisions.
I call Jackie Baillie.
Can I associate the Scottish Labour Party with the comments about the situation in Ukraine and our determination, which I hope is shared across the Chamber, to defend them against Russian aggression? Boris Johnson's decision to dismantle the infrastructure we rely on to keep COVID under control is premature, incredibly concerning, and that it neglects and fails those most at risk from COVID. These are the words of the BMA, and on that we can surely agree. I've always expressed a desire, particularly at times of crisis, for both governments in Scotland and the UK to work together in the interests of Scots, but instead we see conflict. Now, at the start of this month, Scottish Labour published our plan for living well with COVID. It set out our priorities to keep people safe, provide them with certainty, and build resilience into our services. Central to this is the continuation of testing, contact tracing, and isolation. The First Minister talks about a transition phase in which testing will remain free of charge. That appears up to the end of March. It is not clear from the statement what will happen thereafter, so could she set out her plans for focused testing? It's also not clear what circumstances the government will recommend testing for. Is it going to be the same categories as the UK government are using, or are there different categories? And could she perhaps outline what the difference is? Could the First Minister also tell the Chamber what constitutes a low, medium or high risk threat level? Because will it be based on numbers, for example, of those infected, numbers of hospitalisations, or indeed other data, because in the interests of us all having a shared understanding and in the interests of transparency, I think it's really important that we understand how this will be determined. And, Presiding Officer, there is little mention in the framework about long COVID. This is affecting more and more people. And it's especially a problem because their experience on the ground is not as painted within the framework. They are not getting access to services. So, Presiding Officer, at a time when people are looking for more certainty about the future, there are not yet answers to some of these fundamental questions that will be in place to protect Scots. We were promised a framework. This appears more like a progress report. Now, I appreciate the First Minister is waiting for the UK Government to decide, but as public health is devolved, will she commit now to funding testing and contact tracing in order to protect the people of Scotland?
First Minister.
Well, firstly, there isn't conflict on these issues. There is a UK government that is failing to take decisions in an orderly and a competent fashion, and that is the reality. As recently as Friday, we fully expected that yesterday the UK government would set out in detail the testing infrastructure it intended to retain and the funding that would accompany that. I had two conversations yesterday with Michael Gove. In between those conversations, a UK cabinet meeting was postponed because they were still having conflict amongst themselves. Now, I deeply regret that because it has a knock-on effect on Scottish Government decision-making, and I hope they get their act together, and I hope they get their act together quickly. And Jackie Baillie is right to point to the fact that public health responsibilities are devolved, but that takes us to the very heart of the issue. Public health decisions are devolved, but decisions that determine how much resource is available to Scotland, to Wales and to Northern Ireland flow only from public health decisions that are taken for England by the UK government. Now, that's a system I don't defend because I think it is unacceptable and unsustainable, but it's a system that Jackie Baillie and her party, unfortunately and regrettably, do defend. And if Jackie Baillie is not prepared to take my word for how unacceptable that is, perhaps she would listen to the Welsh First Minister, Mark Drakeford, who makes exactly the points I am making about the complete unacceptability of this position. So I have said that we will continue to secure free access to PCR and lateral flow testing for a transition period. I have said today that I would expect that transition period to extend beyond the end of March. We will set out the detail during March, but before we can set out that detail, we need to know, based on the decisions the UK government will take, what resources are available to support that. But the assurance I can give is that that will be the maximum possible testing capacity and infrastructure. I don't want to see what we have created over the past 2 years dismantled, and I want to see the testing arrangements we have fit for purpose and appropriate for the future. In terms of things like the categories of people who we routinely recommend testing for be the same as the UK government? Well, the UK government haven't given clarity on what their categories will be, so I can't answer that question. I've set out the broad priorities for testing, and we will continue to develop the detail. And I think this is my last point on this, I think in line with that fundamental principle that I support, I think Jackie Baillie's party supports, I'm not so sure about the Conservatives, healthcare free at the point of use. Any circumstance in which government recommends testing for COVID, it should provide those tests free of charge. And that is a principle we will seek to the best of our ability to uphold in any future strategy. Now, finally, Presiding Officer, because I know I've taken some time, but there was a lot of questions in Jackie Baillie's contribution. On the low, medium, high threat categorisation, I set out in summary today in my statement, it's set out in more detail in the document, why it would not be appropriate to rely on fixed thresholds of numbers of cases per 100,000 or numbers of people in hospital. And that is because different threats do not have a uniform impact. It stands to reason that if we face a variant that is very highly transmissible but less severe, like Omicron, that will demand less of a response than a variant that is both highly transmissible and more severe and puts more lives at risk. That is why, of course, we look at all of that data, but we will have to continue to apply judgment to that. And there is significant detail set out in the document around that, as there is on long COVID, which is a significant challenge and something that this government and other governments will have to respond to for some time to come.
Alex Cole-Hamilton.